Okay, welcome to another episode of Elevated Medicine, our once a month podcast from Carolina Holistic Medicine and the Priority Health Academy. I'm JP Salibi. I will be one of the two hosts today. My other co-host is Charles, who is our practice manager, and we have a guest today from the West Coast, Michael Turner. Briefly, Dr. Turner is a graduate of undergraduate Stanford University in human biology was his major. Then he went on to Harvard Medical School and then wrapped things up with a residency at the Mayo Clinic in physical and rehab medicine, or also known as physiatry. So let's introduce and bring on Michael to talk about a number of things. I'd like to start off with Michael, your journey, how you went from allopathic training into more of an integrative approach on things.
Yeah, fantastic. Thank you, JP. Really glad to be here and excited to dialogue with your audience today. Well, my journey in some sense began a long time ago because as I was raised in a healthy family with some pretty healthy habits. And so by high school, I was trying to eat right and exercise and, stay trim and stuff. And so I was always sort of trying biohacking, I guess is the word we use now, but trying to stay fit and doing bro science and learning the best I could along the way. And I got interested in medicine, but I just always kept my healthy, proactive concept going, taking responsibility for my health. And I never really felt like the doctor's role was just to come in afterwards and clean up a problem. I mean, maybe I was little bit of a maverick in it, but I just thought, well, the doctor's here to give health and wellness advice, coaching, education, inspiration, as well as solve problems. And so I carried that with me. As I went through medical school, I went through residency. I was a bit of an outlier. I was a guy who had a Ziploc bag of supplements tucked away in my scrub pockets that I take every day, and I was going to yoga classes, after lecture and things. And I was asking questions on rounds like, well, shouldn't this patient have more vitamin C? I mean, they're critically ill. That has a role, right? Or post-surgical patient. I was like, I'm pretty sure they need more vitamin C for wound healing and probably more protein intake. What about, vitamin A or, you know, frail elderly patient who fell? Like, how do we get their nutrition up so they don't have to stay in rehab for 3 months? So these are the kinds of questions. And ultimately, I had a hospital job, which was very comfortable, materially speaking, but in my soul and in my vision for who I wanted to be as a physician, it was not comfortable. And I decided, I need to just go into business for myself. I need to find my own clients, work with them directly, and bring out my best vision of healthcare, sort of from an artistic viewpoint. I had a
Mhm.
vision in my mind that I needed to bring out. So I quit my job and hung a shingle and started michaelturnermd.com.
And that was in 2020,
I was in 2020, January of 2020.
just before like the lockdown hit us. I think we started seeing our first few cases in March of 2020 of
Yeah.
COVID. So you kind of hit the ground running with that. So how did that blossom? Tell me a little bit about your private practice and
Yeah, so I had a good reputation here in the community. I had been around already for 11 years. And so I contacted a bunch of my former patients. They came over. Um, and, all of a sudden there were these new challenges, though, of running your own business, as you understand, hiring and legal and all of it, right? Leases and lawyers and contracts and things, as well as then the evolving COVID epidemic. And I was in a good position because I was actually open for business, whereas a lot of doctors were shut down, based on
Mhm.
hospital policies and protocols. I was like, come on in, we'll help you, let's figure this out. And then my interest in integrative medicine naturally led to a lot of answers that people were seeking, right? Which was, what do I do besides just wait till I'm too sick and go to the hospital? And, I definitely don't want to be on remdesivir and such. And so people were desperate for outpatient solutions, which ultimately led me to a patient talking about Pierre Corey's video on YouTube about ivermectin. He goes, "Have you heard of ivermectin?" I'm like, way back in med school as a parasite med. I mean, that was about it.
Mhm.
I haven't
Right.
talked about it in years. He's like, you should check this video out. So one thing to another, ended up on FLCCC website, started using their protocol very successfully and felt really blessed by it. Like, wow, these people did the work, they did the research, they put it up here and they made that available for me and frankly saved many lives in my community through that.
Yeah. Michael, how many of the conferences, the FLCCC, now known as IMA, How many of
Yeah.
those conferences did you
All of
attend?
them, all of them. I was
All
at
of
the
them.
very first one in Orlando. It was great. I I didn't know anybody. I was just showing up, taking notes, saying hi and all this. And then yeah, all of them. And now to the point of being able to, meet you all as senior fellows and
Sure.
be on stage and talk. It's just been really fantastic.
Yeah, I do recall meeting in Orlando, meeting you, but we didn't ever have a chance to really engage in conversation. It was all so new. There were so many different folks from all over. And I should say, as part of the introduction, that you are a senior fellow with the IMA, one of a few core members, if you will. And we recently did a weekly webinar on nutrition and dietary recommendations. But I know you have an interest in men's health, so you want to speak a little bit to our audience about what that means.
I do. I love it. I have a passion for it. There's a well-defined concept of women's health, and that is great and wonderful and needed. There's not so much of a well-defined concept on men's health. Like, who's the men's health doctor? Is it the urologist? Who is it? The orthopedic surgeon? Like the guy at the gym who's a personal trainer? There's nobody who really owns that seemingly. And it's vital. And not to mention, guys typically have poor outcomes. I mean, we have shorter life expectancy. We struggle more with cardiovascular disease, certain other types of problems than women. So we have a bit of a battle to face there. Not to mention, I think sociologically and psychologically, we don't attend to our health typically as much, right? We're out working, we're hustling, we're kind of prioritizing, you know, bringing home the bacon and not necessarily worried about our health and wellness, but to our own detriment, of course, right? Because then there's a situation where guys retire, their health goes down. I mean, you've probably seen this innumerable times, and they're decrepit or dead in a few years after retirement just for failure of keeping up with themselves. So that's my motivation for it. What I try to do, there are different systems I want to cover in men's health, but some of the core ones are cardiovascular health. So
Mhm.
taking it beyond just a standard cholesterol panel that your primary care checked 6 months ago, right? There are so-called novel cardiac risk factors that we want to look at. We can talk about this in more depth, but I have a big passion for that. My grandfather died of a premature heart attack at age 63, and I was only 13 years old. And we were just starting to have a really, really good relationship and cut off, never to come back. So if he had been able to live at least an average lifespan, I would have had another 13, 14, 15 years with him. But he didn't take care of himself, paid no attention to cardiovascular risk, etc. So there's that. I think another big component of men's health is hormones and hormone balancing. So again, on the women's side, we have a well-defined concept of menopause. We know what that is. It's a phenomenon. On the men's side, what do we have? We're not quite sure. I mean, we could use the word andropause, but that word's not widely known. It's not in the vernacular. So it's just there's nothing. It's amorphous, but it is nonetheless consequential and real. It just happens more gradually than women, which is to say, beginning in your mid to late 30s, you start to lose testosterone production about 1% every year, which turns out to drive symptoms like lack of libido, lack of mood, drive, poor stamina, not making gains at the gym, not
Mhm.
recovering well from workouts, a little bit of weight gain, loss of erectile function. And what's interesting is low testosterone is also associated with Alzheimer's. It's also associated with greater cardiovascular risk. Another way of saying that is when I talk about getting on hormonal therapy with guys, it's not just a question of vanity. It's not just about keeping up with somebody at Gold's Gym. It's about guys with low T are at greater risk of dementia and also heart attacks, and they are more severe if they happen. And so I don't do anything overly aggressive, but I just take people up from a lowish or frankly low T level to a higher one and pay attention to other hormones too. DHEA is a big deal, and we want to keep their estrogen from not getting too high. I could talk more in depth about that, but that's a big focus with the guys. And then cancer screening, obviously prostate we want to worry about, but other types of appropriate cancer screening.
Right. So let's talk a minute about HRT for men.
Yeah.
What modalities do you typically use in your practice?
Well, I start on the conservative side. I start with lifestyle recommendations and supplements. And so I talk about getting quality sleep because testosterone production happens during our deepest stages of sleep and peaks in the morning. And if you're getting interrupted sleep, you're going to have interrupted testosterone synthesis. I talk about, getting consistent exercise, lifting heavy weights, those sorts of things on the lifestyle side. And then on the supplement side, I talk about typically boron is one of my favorites. It helps boost free testosterone levels. It's also good for the brain. Tongkat, Tongkat, Ali, very good. Also boosts IGF levels. And then another herb called Fadogia, Fadogia. So that's my trifecta there that I start guys on as well as talk to them about their lifestyle. One step up from that, I'm a big fan of Clomid. So I use quite a lot of Clomid.
Hmm.
That is nice because it ramps up the body's own internal production of testosterone and thus maintains spermatogenesis and testicular volume and function. Then
Right.
there's direct exogenous testosterone, which is usually a compounded pharmacy cream or an injectable testosterone cypionate. That has its pros and cons, but the pro of that is for guys who are very, very low, Clomid can only take them so high. And so sometimes you take a guy from 100 to 350, 350 is still not amazing. You know, he's going to feel great if he were at 800, but there's a cap on how high you can take someone with Clomid. So those are the cases I reserve for direct testosterone itself.
Gotcha.
Mm,
Yeah. I know there's some clinicians mix the topical transdermal or the injectable testosterone with Clomid. Kind of they pulse it to help keep their testes from deterioration or
good.
shriveling up. Yeah,
Yes.
that's great. Um, Also, something you mentioned earlier about you know, getting getting our selves into a situation. You talk about the guy that's soon to retire from a
Hmm.
long career, let's say as an executive. And it
Hmm.
reminded me of what the Dalai Lama said, Americans are funny. They'll put themselves under tremendous pressure and stress to make a lot of money in their profession, only
Hmm.
to spend that cash of that pile of money in retirement where they're all broken down. So that's where they spend all their
Hmm.
earnings is trying to get healthy again instead
Hmm.
of doing it as you go. I don't know if you ever heard him say that.
Hmm.
But which brings me
Uh,
to my next question for you is mindset. Tell us about you. You mentioned that pre-recording here this morning, and tell us
yeah.
what you mean by getting in the right mindset.
Yeah, this is a big deal for me. I try to always educate and encourage patients along these lines. But there's a healing mindset, let's just say. There's a healing state of mind to be in, just as like there's a healing state of body to be in. And in fact, I think your mind has to lead you there first, right? Because most people to get healthy means you have to have behavior change, right? If you don't do anything different, you're not going to get a different outcome. Well, behavior change is, of course, a mental concept then. So we have to have sufficient motivation. We have to have resiliency. We have to be able to deal with setbacks. We have to have hope that we can actually get better. We have to have belief in the treatment modality and in the practitioner, frankly. So getting a healing mindset, I think, is absolutely the foundation to really start to advance someone. And I would say one of the most common barriers is anxiety. So I don't know if you found this, JP, but I find that anxious patients are some of the hardest to help get better because they're not quite sure if this treatment's going to work. They're not quite sure if this symptom means there's a setback. They're kind of anticipating the worst, and it's really hard to get them to move forward versus what I would call maybe a glass half full mentality, which is resilient and optimistic and hopeful and filled with belief and such. And so I try to move people from one frame of mind to the other, sometimes more overtly than not, sometimes with questions or comments, but I find it vital. I don't know. You deal with a lot of chronic pain and chronic illness too. What's your perspective on the mindset?
Yeah, yeah. So, Michael, I agree with you. There's been a major uptick in anxiety and to some degree depression, but more so anxiety. Now, in decades past, I would see that more common in the female patient, especially perimenopausal, menopause. There's this kind of overriding anxiety. But now I'm seeing a shift towards more men with anxiety, something I hadn't really seen in about 5 years. It
Mm,
started creeping up, and it's just the young female and young male patients, the adolescents, and then our 30,
mm,
40, 50-year-old men having this overwhelming anxiety. It just paralyzes them. So they're kind of waking up in the morning and their glass is already half full. And we try to say, if you have a better outlook, if you wake up, do a little meditation, do a litlittle prayer, and say, hey,
mhm.
this is the first hour of a very good day for me.
Yes.
Sometimes just that positivity helps tremendously. Do you,
Yes.
do you have any idea? I don't know if you've noticed this kind of uptick in anxiety, especially. I think more so I'm seeing it more in men, but do you
Mm.
think it's related to anything in particular?
I don't know. It could be the state of the world in some sense, the economy. It could be some of the COVID and some of the politics and disillusionment that happened. It could be just a younger generation coming through too. I think that's a little bit of it. I think the younger generation now, I would say age 25 or lower, they don't seem to be much resilient compared to, let's say, when we were growing up. All right. And I don't want to be that old guy who's like, oh, young people are getting soft. Everybody says that. But um, I think they've been more coddled. I don't know if it's entertainment. I don't know, but there's like less a sense of self-capability and like, action hero Sylvester Stallone, I'm going to figure this out and like push through this. It's more like I'm going to just break down and get paralyzed and anxious. I need a lot of hand holding. So,
Yeah.
yeah.
Yeah, I think it may be generational thing. I think, the
Mm,
greatest generation, these kind of balls to the wall guys that were adrenaline
yeah.
junkies flying over bombing missions over Nazi Germany or Japan. I mean, these
Right.
guys, that's what when they came back to the States, they were so ramped up and they're go-getters and very ingenuitive. And I think they became sort of the biker generation. They got the Harleys, they got the leather jackets with their emblems on it, reminiscent
Right.
of when they were fighter pilots. And they were kind of hardcore, come get it, Mulan
Right.
Labe, come get it, I'm tough. And you're right. I think the current generations maybe got because of what the greatest generation did for the
Mm,
baby boomers, they got a little slack. And I think that if you look at republics and,
mm,
governments and ancient Greece, Romans, they went through the same kind of transition, the same steps. I think we were a little bit soft. And I think we have addictions to digital devices. We sit and watch hours of Netflix, or we're constantly
mm,
on our phones or computers, and we're not interfacing with other people. And I think the social breakdown of social distancing was really detrimental, especially to
mm.
our younger kids.
Yes.
For years, they were like they couldn't see somebody's entire face. They had, people had masks on, and that broke down some things too. So I think spawned out of that maybe is this anxiety, um, diabolical disorientation, or this theory of dissonance, or
Mm.
people having to pick sides. You're on this side or that side. You're on the left or the right or the up or the down.
Terrible.
It all adds to it. Um, so how would you treat, obviously some counseling and some maybe education on, not being paralyzed by analysis and not being anxious.
Mm.
Do you prescribe anything non-pharma stuff for anxiety?
Sometimes I'm a fan of GABA, the supplement GABA, GABA. You can get that over the counter. It's a neurotransmitter, as you know. It's calming. It calms the gut, first of all, kind of nicely, but it's also has some systemic activity.
Hmm.
So I'm a fan of that. I'm a fan of breathing techniques. So to keep it simple, I use a simple 4 count breathing concept. So 1, 2, 3, 4, inhale, 1, 2, 3, 4, exhale. That 4 count breathing is shown to sink into parasympathetic activity in the body, which is relaxing. It will lower your heart rate. It will lower your perceived level of tension and stress. And then there are some apps that go along with that, right? So there are apps that help guide you through certain breathing patterns. But if someone wants to keep it very simple, just I tell them go outside or look at something outside and start some 4 count breathing and don't stop until your watch goes off in 5 minutes or something like that.
All
Take
right.
a break. What's interesting, I'll never forget, JP, probably been 20 years ago or so, but I read there's this study about blood pressure and people, they looked at office workers who had high blood pressure and just looking at a picture of a nature scene in their cubicle they told them to stare at this thing for 5 or 10 minutes. It did positive things for their blood pressure, right? Not even having to go outside, just looking at a picture of outside did
Okay.
positive things for their stress and their anxiety and their blood pressure. So,
That's awesome.
yeah,
Yep.
yeah.
That's awesome. But yeah, I know that the breathing techniques you just described, or there's some others called box breathing or square breathing, can
Yep.
actually lower cortisol levels for up to 4 hours
Mm,
afterwards, just doing it once, and also blood pressure and heart rate. I think we live in a very stimulating society. I mean, 100,
yes.
150 years ago, we didn't have all this input. Now we do. And I
Right.
think with AI coming ashore, that's going to even be made worse, more compounded, and we just need a break. People don't daydream anymore. They're always, oh, I got a minute. Let me check my email or let me check my texts.
Ah, yes.
They don't daydream. But well, let's talk a little bit about another one of your favorite topics, which is exercise. Tell us how you instruct some of your patients on exercise.
Sure. The first thing I tell them is it needs to feel fun. And so, speaking of imagination, the beginning of it is sort of an open conversation. I tell them, what feels fun to you? Is it walking a dog in the neighborhood? Is it hiking some nature trail near your house? Is it CrossFit? Is it yoga off YouTube? What feels fun to you vis-a-vis moving your body? Because just sitting in a chair all day is not fun. So people are like, I don't like to exercise. I'm like, yeah, but you don't like to just sit trapped in a chair either. So what would you do with your body that could feel fun? We got to get your mind opened up a little bit. And so they'll tell me whatever they tell me. I'm like, great, we're going to start there because I want this sustainable. And it's not sustainable if it doesn't feel fun, right? If you're just operating out of willpower and grind and I'm supposed to, and my doctor nagged me and I should, and all this stuff, those are the people who start every January and by March they're done. They're out of the gym, right?
Hmm.
Because they were never intrinsically engaged in it. So I first have to tap into what's your fun, and then I have to work from there. Let's say your fun is some form of cardio. That's great. Now I have to maybe add some strength training to that or some stretching, right? Or vice versa, or add some intensity. So your fun is you walk around the neighborhood. Well, when that's a little too easy, I tell you, get a 20-pound weighted vest off the internet. Now go walk around the neighborhood, do some
Hmm.
yoga, do it with a 20-pound vest on, these kind of things.
Right.
And so just working to expand them out, but at the core, it's got to feel fun. I use the phrase adult recess. I tell them when I go to the gym, it feels like recess. When you have recess, the teachers don't say, make sure you run around, make sure you get some energy out. The bell just rings, you just do that naturally. It's fun. When you go to the gym, when you think about exercise, it needs to feel like adult recess. Don't burden it with expectations. Just go move your body, do something. My rule of thumb is break a sweat. It's like number one, it's got to feel fun. And number two, break a sweat. And if you're doing that, you're getting a decent exercise in there.
Right,
Yeah.
right. We got to warn some of our folks about over exercising, not only the health implications with cardiovascular stress and all that, and stress in general, but
Yeah.
also injury. They're more prone to injure an ankle or their lower back. So I like your comment, and I've quoted you before in patients about because they'll always ask me, well, I do 30 minutes on the elliptical, or I do 45 or an hour, or I swim laps for an hour. And I like the fact that you said do it until you kind of break a sweat, and then because that could mean things for different people. And if you're deconditioned, you could break a sweat in 30 seconds, and if you're
Yep.
a pretty good high level athlete or weekend warrior, you can, it might take you 45 minutes to do that.
Yep.
That's fantastic advice. Well, Michael, we're coming up on the 30-minute mark, and we'd like to keep these to about 30 minutes.
Mhm.
So tell the audience where they can reach out to you if you have a website or a means of contacting you if they wish for your services.
Sure. There are two ways. There's my Substack channel, which I put out a lot of health and wellness information, and that's drturner.substack.com. And then there's my website for more personal engagement. That's michaelturnermd.com.
Very good. Awesome. Awesome. Any last closing comments? And I'll ask Charles if he has any last minute questions.
Well, I would just encourage people to view health as a journey, and it can be fun, and um, it's worth it. It is more pleasing to live in a body that's not in pain and that has a sufficient amount of energy, right? And it doesn't have the burdens of chronic disease than not. And so it's worth it to start to make that transition and make a plan and make it fun and start to build that out. I also tell people you'll never be as young as you are today. Just
Mm.
simple fact. You will never be younger than you are today. So this is your chance. You're never going to have more life ahead of you than you do today to start to make some changes.
Awesome. Awesome advice. Well, listen, Charles, anything to add or
I just want to just make a comment. I really love your positive attitude. You're very, very optimistic, and it's fun to listen to you. So, Thanks for this time today.
Okay.
Normally, when you go to the doctor, sometimes they're pessimistic.
Right.
you know, so
Yeah.
it's been a nice. You have a great bedside manner. So thanks for
Mhm.
this time today.
Yeah, Michael, I must also make that same comment that I find you a nice person to be on one of our IMA committees or one of the Zoom meetings because you are sort of a person of level-headedness and just overall nice. I mean, some doctors get accused of being not so nice sometimes, but I've always
Mhm.
found you, non-confrontational and easy going. So I thank you for that.
Mhm. Thank you. I appreciate to hear that. And yeah, Charles, glad to be here. And JP, look forward to working together, on IMA stuff or otherwise. I wish you all the best there with your practice. And I'll continue to send some people out. I've mentioned it on a number of occasions already. So,
Very good. Very good,
mhm.
Michael. It was great having you as a guest. And this wraps up another session with Elevated Medicine, our once monthly podcast. We'll see you next time.